vaccination drive. In Florida, we've done almost 4 million senior citizens, really focused on the seniors and the at-risk population. You saw that throughout the country. There was the hope, well, we fully expected that to provide protection against severe illness, but there was also the hope that that potentially would create an effective shield of immunity to make it so that infection waves were not going to be as significant as we had seen in the past. I think on the former, if you talk to any of the hospitals throughout the state of Florida, I think they will tell you that the overwhelming majority of the people that they are admitting into their hospitals for COVID are people that had not been vaccinated, that the vaccinated population is less likely to be admitted into the hospital if they get infected, and we are seeing breakthrough infections. And so from that perspective, preventing severe clinical outcomes, we've seen a lot of protection for a lot of vulnerable people, and that has made a big difference. Now, what you haven't seen is widespread vaccination limiting waves. It's not just in Florida or the whole South, it's all across the world. You look at Israel, they're one of the most vaccinated countries on planet Earth, and they're having their biggest wave of infections that they've had throughout the whole pandemic. Obviously, Florida, other Sunbelt states, but even like Hawaii, very vaccinated. You know, we're the most vaccinated state in the Southeast, and we've got over 85% of seniors fully vaccinated, but yet you see with this Delta variant, more contagious, very easy to transmit, and it comes really in waves. And so as we're looking at that and say, okay, vaccination is clearly helping reduce serious illness. It's reducing your likelihood of being hospitalized, but you also have people who are being hospitalized. So what tools do you have that makes the most sense? And one of the things we've been talking about recently is doing monoclonal antibody treatments such as Regeneron. We've done that in different hospital systems have done it. They're doing it here in Northeast Florida, but it was something that the more we talked about it, the more people had questions. A lot of people had not even heard of it. And so we see an effort to be able to supplement that effort here in Northeast Florida and other parts of the state. We'll have additional announcements very soon, partially to be able to get more people in, and we're going to bring in a lot more Regeneron into Florida, which I think is important, but also just to raise awareness that this is the most effective treatment that we've yet encountered for people who are actually infected with COVID-19. And the way it works, I mean, the core group of people that benefit from this are folks that are at the most high risk for severe illness from COVID-19. So elderly people that have certain comorbidities, kidney problems, diabetes, morbid obesity, immunocompromised. This, if applied early and properly, has the ability to reduce your likelihood of being hospitalized by 70% in clinical trials. And I think if you talk to people that have had it in Florida, most people will say that if you do it early, it really does help to resolve the symptoms. And so what we're going to be doing here today is deploying a rapid response unit. This will starting at noon. We'll be able to deliver Regeneron monoclonal antibody treatments to folks. The key to this is if you're in one of those high-risk categories and you become COVID positive, doing it before the symptoms get very severe is when it's most likely to work. And so part of it is some people don't even know that this exists until they end up getting admitted to the hospital. And at that point, it's almost always too late for this to be effective. But part of it is just kind of a natural human instinct. Maybe you feel some symptoms, test positive, but you don't feel that bad, so you figure, hey, I'm going to clear this. If you're high risk, though, and it progresses, then you've missed your opportunity to have this be really effective. So that early treatment is really what the Regeneron and the monoclonal antibodies represent. So that's really what we're doing. So they're going to start by just taking referrals from the health systems here in Northeast Florida, but we are going to be moving to allowing this to be done on even an individual basis, coming in and making appointments, and we think that that's something that's very important. Clearly, This has now been employed on an emergency use basis since the end of last year. So we have a lot of time to have watched what's happened, and there's clear benefits to this early treatment for keeping people out of the hospital and reducing mortality. And this is also true whether you're vaccinated or not. I mean, obviously, if you're vaccinated, we think the data in the hospital shows that your chance of being admitted and having a severe illness is less than if you weren't. But at the same time, we are seeing people testing positive in higher numbers than I think most people anticipated, and that's just not in Florida. That's really in places like Israel and other places around the world. So if you're vaccinated or unvaccinated, if you're in those high-risk groups, you can still do the monoclonal antibody. The only issue I think that doctors would tell you is if you're not vaccinated, high risk, you come in, you get infected, come in and get it, absolutely. You get the treatment. You have to ask the physician at what point in the future, if you do want to get vaccinated, do you have to wait because there's antibodies and they want that to be able to clear. But that's really, at the end of the day, the only major thing that you need to look at. So who are the high-risk groups that would most benefit from this? Obviously, elderly populations, people with chronic kidney disease, diabetes, morbid obesity, cardiovascular, chronic lung disease, people with sickle cell. Those are the folks that, if infected with COVID-19, may end up seeing significant consequences and could result, of course, in a hospital admission or worse. So if you do it early, this has a great chance to resolve those symptoms short of you needing medical attention. And that's really, at the end of the day, what it's all about. So we want to be able to do all we can to be able to do. Now, what we're going to do is, so we have this here. This is helping relieve some of the pressure, because I know they're doing a lot in these health systems. So this is supplementing that, and we'll expand as needed. And really, it's just a matter of you can do it through IV or you can do it subcutaneously. If you do it subcutaneously, it's easier to do, so you can probably get more people through if you have the appropriate setup. So we're going to be expanding as much as we can, and we may use other footprints in Jacksonville. And then we're also looking beyond and throughout the state of Florida. There's websites. HHS has a website, for example, about where you can get monoclonals. The problem is, if you go on it, some of these places, some of them have it, but they just aren't administering it, and others don't necessarily have it. So what we're looking at is, are there gaps in certain parts of Florida where we can bring some of these mobile units and then be able to offer this to folks who get infected in early treatment. And I think this is going to be something that has just got to become part of the standard of care as you go forward. This is going to be with us for a long time. I mean, I hear these politicians say they're going to conquer it and end it. It's not going to be eradicated, as we've seen. It has different iterations. The vaccines obviously are helping people avoid severe outcomes, but you're going to continue to have this, go in the different patterns. So understand, if you're in those risk groups, that this is really something that you need to be thinking about if you end up with a positive test. So we're going to be doing that. We're also going to be doing strike teams to be able to bring it into nursing homes if you have some nursing home infections. And we've seen that. Nursing home residents were some of the first people to be vaccinated, and I think you saw a huge decline in cases in nursing home residents, but you are seeing more of that now in different places. And so if you do have somebody test positive, obviously you can help that resident. You can also use it as prophylaxis. So if there's 6 other nursing home residents, maybe none of them have tested positive yet, you can go in and offer the Regeneron to them, and that's proven to help them avoid infection entirely if you're able to get it early enough. And so we'll be using it for that as well. So really focusing on providing early treatment for the most vulnerable to keep them out of the hospital and ultimately to save lives is what we're going to do. Remember, the sooner you do this, the greater the chances of success that you have. There have been a lot of people that have been helped by this, but I really believe that had more people known about this, I think absolutely some of those folks would not have ended up needing to get admitted to the hospital. So I want everybody to know that this is an important option, that this is an important way to be able to protect yourself in the event that you are infected. And we're going to be doing this in other parts of the state, and obviously working with our long-term care residents who we've been working with from the beginning to make sure sure that they're provided the type of protection that we can. So I want to thank Mayor Curry for working.
Now notice this word early.
Expensive. That's why researchers in Singapore have developed a chip which can be plugged into an existing DNA analysis machine. As a result, researchers in Singapore have developed a chip which can be plugged into an existing DNA analysis machine. As a result, a single sample from a patient, perhaps a saliva or a blood sample, can be checked for 70,000 different viruses and bacteria. Each of these tests currently costs between $20 and $200. So to be able to do the lot for just $450 represents a massive advance.
There are some patients, about 10% of them, after being in the hospital for 2 weeks, they still remain undiagnosed and they're still sick. And about 25 to 30% of hospital beds are taken up by these infectious disease patients. So if you are able to figure out the diagnosis early, you could give them the correct treatment early, and then both the patients, the insurers, as well as the hospital would all save money because there will be a shorter patient stay.
The chip's developers are waiting for US government approval before it can be used for anything more than research. But with a growing number of bird flu cases in China and tightening health budgets around the world, some hospitals have already placed their orders. Tarek Bazley, Al Jazeera.
2 Corinthians, the 2nd chapter, verse 11. Lest Satan shall get an advantage of us, for we are not ignorant of his devices. And so this is 8 years ago that they was pushing a chip to detect viruses. Now you got the governor saying we have a treatment. If it's detected early, it will be like a cure for the virus. And so this is the plan. And it's almost perfected. But I'm going to leave it there. All praises to Yahweh Hashem, Yahweh Shah, Hashem Rekakadash. Double honors to the elders pushing the truth. Peace of the elect worldwide. Our kingdom is at hand. Shalom.